So how easily, sir, you define HAE?
So HAE is a hereditary angioedema. It's a rare autosomal dominant condition which is caused by either C1 esterase inhibitor deficiency or functional inactivity. There are several other mechanisms, but the main mechanism is an immune mechanism by which the body is unable to stop certain pathways in the body, as a result of which this disease occurs.
What are the most common symptoms you see in your HAE patients, sir?
So, of the many patients that we have seen, the commonest presenting symptoms are episodes of swelling.
Okay.
These episodes of swelling can come either on the face, like the lips, the ears, the eyelids, the entire face at times. They can also come on the hands and legs. They can sometimes even come on the private parts of an individual and be very disfiguring in some ways. Besides this kind of swelling, pain is often associated with the swelling. And if you go a step further, if the same swelling occurs inside the body, it can lead to swelling of the intestines with a lot of abdominal pain, which can become extremely severe. And also, sometimes if the swelling occurs in the airway of the person, in the breathing tube, it can lead to a serious medical emergency that can be life-threatening.
How can patients, sir, actually understand about the triggers of an HAE?
So generally, when we have a suspicion for HAE, we ask the patient a lot of questions about the type of situations in which they have developed these episodes of swelling, pain, sometimes even cough or difficulty breathing if there's airways involved. And usually they have to keep a diary which looks back at the preceding 6, 8, 12, 24 hours before they got the swelling as to what triggered it, right from minor trauma like a simple injury, a fall, maybe even a very vigorous dance that the person might have done, to serious injury like a surgery, a traumatic childbirth, to having a very bad viral infection, to being under extremes of stress. There can be many different triggers for these episodes of swelling, and hence the patient has to maintain a diary and keep a record of what they were doing prior to these episodes, and that helps us narrow it down.
Coming to the diagnosis and the screening part, which is very important for clinicians. So, sir, apart from all these symptoms, what are the other signs and symptoms an ACP can probe to diagnose such HAE patients?
So I think the biggest challenge, Dr. Sobeshwar, comes in ruling in or ruling out HAE. So when we have to rule out HAE, there are certain historical factors that are very critical, such as the patient developing itching or red rashes on the body, what are called hives. When these are present, you can usually very comfortably say that this person does not have HAE, because HAE is never associated with itching. It is not associated with urticaria. Urticaria is the commonest reason that a person may develop swelling. Also figuring out whether they have allergies, because people often think HAE is an allergic disease, whereas HAE is not an allergic disease. So it's actually due to a deficiency or a defect in a chemical pathway or a immune pathway in the body. So asking them questions about what other symptoms they had, what medicines helped them relieve the problem, because many a times if they get the history that despite taking oral steroids, intravenous steroids, despite taking epinephrine, despite taking antihistamines, they were not better, that should really raise a red flag for a diagnosis like HAE. So I think there are many things in the signs, symptoms and history that we can look at, and then there's always a prodrome. A prodrome where the person has tingling, they have some discomfort or pain, they have potentially anxiety, irritability that comes on before the swelling comes on. So there are quite a few things that can help us narrow down the HAE or rule it out.
Coming to the screening part specifically, what are those screening tests generally you recommend for diagnosing or confirming that it's an HAE case?
So that's a very important question, because essentially there are three main tests that help us narrow this down. The first is checking the level of the C1 esterase inhibitor protein, which we all have in our blood. It is an essential part of human survival, and checking a level of it is the first step, and that gives us a diagnosis if it is low of something called type 1 HAE. The second we do is we look at a functional assay of the type of the C1 esterase inhibitor protein. which gives us an idea whether the person has type 2 HAE, where the protein is there but it's not working in the body. And then the third test, which is very, very important, is something called a complement 4 level, easily available, a blood test. All of these are blood tests. And the C4 level, when it is low, is a strong indicator of HAE and needs to be done at the right time, and sometimes needs to be repeated in or around an attack to get the best results, because once in a while the results may be normal in between the episodes or the attacks of swelling or symptoms.
So as you mentioned, sir, on the time of attack or at least some hours down the line after the attack, is C4 level really important for diagnosing the HAE patients?
So we will always consider C4 level a supportive test. It's not a test that has to be abnormal, but generally in most cases, because there are variants of HAE where the C4 level may be completely normal during and after attacks also. But if it is there, the essential, as I would say, 90-95% of cases that we may see which have type 1 or type 2 HAE, the C4 level is relevant and important, but a normal C4 level does not rule out HAE. We still have to look deeper and further.